it's Jenny here, the Prevention DPT. Today we're talking about the top things I as a PT wish you as a patient knew. And today's video 2, we're talking about quality care is questioning care. That's my alliteration of the week. But really what I mean is be your own advocate. So when you go in, and we're going to start with just talking about going into your doctor's office, so your primary care physician, you're having pain, you're wanting that PT referral, and you go into your doctor's office. Be your own advocate. Make sure you have any information you need about your health available and written down for you. So that means, your medications, when your pain started, everything you can think of, how that pain occurred. Was it an injury? Did it just come on gradually? On a scale of 1 to 10, how painful is it? What does it feel like? Have every bit of information you can available to you, and also a list of questions. I tell this to all my patients. Have a list of questions. You're going to think of a million things you want to ask your doctor before you go in the office. When you get in there, you're going to forget all of them. You're going to go blank. They're going to tell you what to do, maybe write you a prescription, head you out the door. You're going to get in the car and think, oh, I forgot to ask this and this and this. I do it. Everybody does it. Have a list of questions written down so you can make sure that everything is covered. You're not going to want to make another appointment. You get a brief period of time with them. Try to make sure you have those questions so that you can make sure everything is answered. And then ask them why they're doing what they're doing. So for example, with pain, if you're going in there because you want a PT referral, you're having pain, and they prescribe you a pain medication, ask them, is this an opioid? Because we have so much evidence that shows that opioids are not going to benefit you long term. Is this pain medication the only thing you're going to do for me? What about a PT referral? There are many doctors, not all of them, there are tons of wonderful doctors that send out PT referrals as soon as possible. But I do have patients that have tried pain medications, tried this, and never got that PT referral, and they end up in that chronic pain category where we're kind of fighting against all the things we talked about in video 1. So when you go in there, ask them. They might not have even thought about it. Ask them for that PT referral. Don't be afraid to be your own advocate and ask for that care. Before you go in, do some research on what's going on. And just like in my video where I talked about how to trust what you see on the internet, use .org, .edu, .gov. Those sites are going to be more reliable than .com. Not necessarily 100% accurate and not necessarily 100% reliable or correct, but you're going to be more likely to get quality information from those sites. Google Scholar is another one that will actually bring up research articles. You just want to be careful when you're looking at those things, that you're looking at what date it was printed. If it was before 2000, I take those with a grain of salt. I want current research, and then also what you want to look for is a meta-analysis or a systematic review. Those are research articles that are actually looking at a bunch of research articles and combining the results of all of those into kind of an assessment of what we're seeing in the research on whatever those articles are targeting. So, look into that, have some questions for your doctor, and, it's really hard for our physicians right now because they are overworked, they are overstressed, they have very limited time with you, they've got such limited time to do everything they need to do in a day. So a lot of times they're going to rush, want to write a prescription, and have you out the door. And they can come off as annoyed if you start asking questions and you want them to take a little more time with you. You have the right to ask those questions, though. You have the right to the time to have that doctor go through and answer everything you want answered, and to answer it fully to a way that's satisfying to you. Okay, so if they come off a little annoyed, take that as it's the job, it's not you. If they write you off and well, whatever, and they don't answer your question or they blow you off, go up to the reception and ask to see another provider and tell them what happened. I know that's hard because for people like me, we don't want to make anybody upset, but the reality is, be your own advocate. You have the right to quality health care, and if your physician's not doing that, then you need to see somebody else who's going to take the time to answer your questions and give you the best care possible. And that includes PTs as well. If your PT is not answering your questions and they just blow you off, ask to see a different PT. Now, with that being said, there's a big caveat to this. we live in a wonderful, amazing time with information coming out all the time, right? Or on the same spectrum of that, no human being can keep up with everything coming out and all the information and all the studies and all the treatments all the time. We are mere human beings. So if you see something and you have questions about it, and like I've had this happen, a patient comes to me and asks me something that I've never heard of. What I will tell them, and what your physician or your PT should tell you is, wow, that's news to me. You know what I'm going to do? I'm going to go home. I'm going to do some research on that. I'm going to research how that might affect you with your particular situation and your diagnosis. And then at our next visit, we're going to talk about this. With your physician, maybe it's I'm going to research that and I'll give you a call tomorrow, or have my nurse call you tomorrow and have an answer for you. For PTs, you know, we tend to see you guys more than just once, so we'll have an answer for you at your next visit. That's what they should tell you, and that should make you feel great. Not, oh, my PT didn't even know about this, but that my PT is going to use their education and their knowledge to go and research something that might be a new thing that we just hadn't heard of yet, and they're going to come back and they're going to help me make a decision as to whether that's going to be beneficial to me. That's what I want to see. That's a good physical therapist. That's how you know they're doing their job. So don't be afraid to ask those questions, and if you're tripping them up, then they need to go home and do their research and have an answer for you next time, okay? So again, if they come off a little annoyed, take that with a grain of salt, because everybody, I mean, you know what it's like. You go to work and you get irritated with stuff. It doesn't necessarily reflect the people around you. It's just a situation. That exists for all of us, and the healthcare system is hard. But that does not mean that they should not be providing you with the best level of care, answering your questions, and making sure that you leave satisfied, okay? So that's number 2. That's it. Be your own advocate. Ask questions. Your healthcare is in your hands. So if you stick with a bad healthcare provider, then that is on you. If you are advocating for yourself and asking for a better provider, then that is on them, right? You are taking the initiative to make sure you get the best care, and then that is the responsibility of your healthcare provider to be providing better care and to work harder to do the best for you. So that's it for this week. Next week, join me for video 3. If you have any questions, or you want, you know, anything that you have an idea for a future video that you'd like me to cover, please comment below. Please like and subscribe, of course, and we'll see you next week.